Hi, I'm Sinziana Avramescu from Toronto, Canada. I'm an assistant professor of anesthesiology and pain medicine at the University of Toronto, and I am a 2013 IARS Mentored Research Award recipient. This award affected my professional trajectory in so many different ways. It was a major international research award that was open to non-US researchers. I was born and raised in this tiny town in Romania in Eastern Europe, and I went to high school, to a high school that was established in the same year as the creation of my adoptive country, Canada, in 1867. And little did I know that this country will become my own and that I will spend most of my adult life as a Canadian. I felt incredibly lucky to be able to build a research career at the same time as being a clinician and an educator, which would have been impossible really without this award. So I guess in a nutshell, this award was a major stepping stone in my development as an academic anesthetist. The research topic of my IARS Mentor Research Award, and in fact the area of research for my PhD as well, was traumatic brain injury, as I said. And I have a very personal story related to brain trauma, which is why I was so passionate about this topic in the first place. When I was 17, I was involved in a car accident as a pedestrian, and that sent me unconscious to the ICU for a while. And as I was recovering from this episode and from this significant brain injury, I started thinking how fascinating it was that my brain was still not functioning as before the accident for months and months after. Although all the tests that were done at the time to assess the structure of my brain were normal. And that was the moment when I decided that one day I will become a brain scientist.
In 2013, as a senior resident in the Department of Anesthesiology and Pain Medicine at University of Toronto, Dr. Sinziana Avramescu was awarded the IARS Mentored Research Award for her research Do Anesthetics Exacerbate Memory Deficits Following Traumatic Brain Injury?
At a high level, the goal of our initial research program was to better understand the consequences of traumatic brain injury, or TBI, and to develop mechanism-based strategies to help with memory loss after brain trauma. Our findings provided the first proof of concept evidence that these particular receptors, the alpha-5 GABA-A receptors, could be the targets for treatment of memory loss after brain trauma. Our research evolved a bit over the years, and the angle of our research focus changed from a very narrow lens on concussion and brain trauma with the initial IARS award to a very broad area, perioperative brain health. And that's because that is where we have the biggest impact as anesthesiologists. Brain health research is now a very important topic, and with the population expected to live longer, we must do everything we can to preserve brain health. Another thing that we were able to do because of this study was to be able to build a research program, a multidisciplinary research program. And in 2017, together with my mentor, Dr. Beverly Orser, and with my collaborator and colleague at the time, Dr. Stephen Choi, we co-founded the Perioperative Brain Health Center at Sunnybrook in Toronto. And that was the first center that focuses on bringing together patients, healthcare professionals, and researchers to design new diagnostic and treatment strategies for perioperative brain dysfunction, such as delirium, postoperative confusion, and memory loss, and so on. I was able to create our first perioperative research unit at Humber River Hospital, and now we partner with several academic centers across Canada, and we serve as a research site for multi-center clinical trials. I'm a member of our hospital's research executive committee, which establishes research priorities and the vision for our research institute. My hope is that in the future, when people like my 17-year-old self feel that their memory is not quite the same after an episode of concussion or brain trauma, we could do a very special scan of their brain and look at the particular receptors. Even if the structural tests are normal, the function of the brain may be different, and we could potentially track that in the future.
Your IARS membership and donations enable the support of future research leaders who will advance the science. Thank you.